Hi, my name's Whitney Shire. I'll be your nurse practitioner today. What's your name?
Jackie Shire.
Jackie, great to meet you. Just gonna wash my hands here. And Jackie, what brings you in today?
A checkup.
Okay, great. I'd be happy to perform what's called a head-to-toe assessment on you today. Can you first tell me the day?
It's Friday, September 1st.
Okay, and where you are?
Research Hospital in Kansas.
Okay, Jackie is alert and oriented ×3. Jackie is appropriately dressed for the weather. Her mood and affect is upbeat and appropriate. And Jackie, I'll just begin by doing a general skin assessment here. Skin is warm and moist. I do note a freckle. We call that a macula. It's about 4 millimeters in diameter. It's brown and flat. Have you noticed any tenderness or drainage?
No.
Okay, great. No concerns there, just a freckle. Moving on to your head. Hair is very nice, thick, beautiful brown, evenly distributed throughout the scalp. And the scalp is pink, healthy, not noting any dandruff lesions, no concerns with the hair or the scalp. Okay, also with your head, Jackie, I'm going to test facial movement and sensation. If you could tell me, does it feel the same here as it does here?
Yeah.
And here as it does here?
Yeah.
Okay, and can you smile? Raise those eyebrows? And puff your cheeks. Great, equal facial movement and sensation. Jackie, also with the head, we want to check for TMJ. So let's check that temporal mandibular joint. If you could clench, open, close. Okay. And the temporal masseter, if you could move your jaw side to side, forward, open, close. Okay. No signs of TMJ, no popping, clicking, locking. Did that cause you any pain?
No.
Okay. Moving on to the neck. I'm noticing the trachea is midline. No signs of lumps or masses. We'll check the sternocleidomastoid. If you could push your face against my hand. Face against my hand. And shoulder shrug resistance. Great. Okay, that's all normal. So now for the lymph nodes. We're going to check the preauricular, the postauricular, occipital at the base of the skull here, tonsillar, submandibular, submental, superficial cervical, posterior cervical, supraclavicular, infraclavicular, and the deep cervical. So I note that all of her lymph nodes are mobile, small. I didn't note any swelling, inflammation. Did any of those cause you pain or tenderness?
No.
As I palpated? Okay. So moving on to the eyes, Jackie, I note they are appropriately placed equal on the face. I'm going to shine a light here in both eyes. Oh, let's take those glasses off if you don't mind. Okay. Shine that light again, I'm sorry. Great. I note the pupils are equal and reactive to light and dilate appropriately. I'm getting a red light reflex. Another red light reflex. Both eyes, that's appropriate. I'm going to check the conjunctiva. Pink and moist, and the sclera of your eyes is white, which is all normal, no signs of jaundice. The eyebrows are thick, full, no signs of thinning towards the ends of those eyebrows, which could be indicative of disease. And the eyelashes are thick and full, and no signs of styes or disease, and they are also not inverted. So I believe that's it with the eyes. Now the ears, the upper auricula. I'm going to palpate those, inspect those. Any pain, tenderness? I don't know any lumps or masses, and they are in line with the outer canthus of the eye, so they are normally placed on the head. The bridge or dorsum of the nose and tip of the nose is midline, equal with the center of the face. Noticing the mucosa is moist, pink, no lesions. Shine that light. Not noticing any signs of obstruction, but just to be sure, let's have you close one and sniff. Close one and sniff. Great. Okay, that's normal with the nose. Now the mouth. If you'd like to put your glasses back on, you're more than welcome. Okay, so the mouth. If you could open for me, Jackie. Stick that tongue out. Great. Buccal mucosa is pink, a little wider for me. Open. Okay, pink and moist. No signs of dryness. The papilla are normal, none inflamed or red. You can close for a moment. Okay, and open one more time. She still has her tonsils. They're not inflamed or red. And I note the uvula is midline. Can you lift your tongue? Okay, frenulum intact. Soft and hard palate also intact. No lesions. Open and show me your gums. Nice pink, healthy gums. Also nice white, healthy teeth. No dental caries. Very good hygiene there in the mouth, Jackie. Keep brushing twice a day. Moving on, I believe we already did the trachea, sternocleidomastoid, or mastoid, TMJ. So I think we're ready for the lungs. So first I'm just going to palpate for any masses or concerns. If not a breast exam, just palpating any tenderness or lumps you've noted.
No.
Okay. Now tactile firmitis is checking for any vibrations or signs of pneumonia. If you could say 99 each time I place the base of my hand.
99, 99, 99, 99, 99, 99, 99, 99.
Great. Okay, I'll go ahead and listen. Oops, sorry. Okay, no adventitious sounds, no wheezes, crackles, rails that I've noted. All along I've watched you breathe, counted about 18 respirations, which is normal. About 12 to 20, 24 max is normal for an adult. So your respiration rate of 18 was normal. I didn't know any signs of labored breathing. Have you had any cough, wheezing, concerns
No.
with the lungs? Okay, great. So if you could kind of turn, and I'll do the same on the posterior here. Feel and palpate. No lumps, bumps, or masses. Tactile firmitis, 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and I'm going to percuss those lungs. Okay, and take a listen to all the lobes. Usually I'd have you with your shirt off, but for your privacy in this video, we're keeping it on, of course. But for the best sound, we want it through the clothes, or like with the clothes off. Okay, I did go below the bra line, obviously, or sometimes that gets missed, but we did it here. We don't ever want to forget to go below the bra line. So now you can go back to your place and moving on to your heart. I'm going to take a listen to the PMI, the point of maximal impulse, or the apical pulse for 1 full minute. Okay, 1 minute has passed. I noted a pulse of about 70, which is within a normal adult range. And now I'll just listen to all the valves, okay? The aortic, pulmonic, Erb's point, tricuspid, mitral, and now I'll listen with the bell. Okay, wonderful. I noted a normal S1 and S2. No gallops or murmurs were noted. So everything with the heart sounds great. So let's move on to the abdomen. If I could have you lay down, or you know what? Let's do the peripheral vascular. Let's go in order of systems that are appropriate here. So put those glasses back on real quick. I'll inspect the fingers. Okay, not noticing any clubbing. Capillary refill is normal, about 2, not too brisk or slow. Capillary refill, great. I'm not noticing any edema in the upper or lower extremities. Skin turgor, normal. It's elastic, no tenting or signs of dehydration or overhydration. And the hair growth on her legs is normal. I'm not noticing any heat, warmth, signs of clots or cellulitis. It's warm and moist. Okay, let's listen, or feel rather, those pulses. So we've got the carotid. Okay, we've got the radial, brachial, radial, brachial. Okay, normal and rate and rhythm so far, about 2+, not bounding, not weak. Femoral, normal and equal. Popliteal, normal and equal. Tibial, normal and equal, about 2+. And pedal, normal and equal. So that completes our peripheral vascular. So now if you can lay down, we'll move to the abdomen. Okay, so I'm going to do a light palpitation, deep palpitation, any pain or masses, tenderness there. I'm not noting any either. I note that Jackie's abdomen is flat, soft, no varices or vasculature I'm worried about, no striae, it's not obese. She seems very healthy. I'm going to palpate for that liver. She is very petite and fit. It's possible I could feel the liver, spleen, or kidneys since she is so tiny, but I'm not feeling it, so that's good. Not inflamed, not tender. Okay. Let's see. I'm not noting any umbilical hernia. Have you noticed any concerns? Okay, no hernias. Now I'll take a listen to those bowel sounds for 1 full minute. The right upper, the left upper, a little hyperactive over there, right lower, and left lower. Hyperactive on that right side, must be a little hungry. Okay, I think that completes everything for our abdominal inspection, so I'll help you sit up if you need it. Great, let's go back to where you were. And last but not least, we've got motor functions to test. So first I'll just inspect the spine, inspect and palpate neck, shoulders, signs of crepitation, nope, elbow, wrist, hips, knees, ankles, and feet. Those are all normal. So now let's test strength and resistance. If you could pull and push against me. Okay, make a fist. Okay, open. Put those thumbs down. Touch those thumb and forefinger. Great. And now grasp my hand for strength. Wonderful. Okay, let's check for crepitation of the knees. Okay. Let's check some mobility, range of motion of the neck and the spine. If you could hyperextend the spine, lean back, lean forward, touch your toes. Great. Neck, back and forth, side to side. Shoulders and arms up. You can lift those arms up, out, forward, up and back. down and back. Okay, and now hips and knees and legs. If we could do like an adduction, taking it away. I'm sorry, abduction, taking it away. Abduction, taking it away. Adduction, bringing it in. Adduction, bringing it in. Okay, and external rotation of the hip. External rotation of the other hip. Careful. Internal rotation of the hip. Great. Internal rotation of the hip. Ooh, wonderful.
Try that again.
Okay, yeah, glad that's there for your balance.
Okay.
I believe that completes our range of motion and strength. So let's have a seat, and I will grab some things for our sensory test here. We're almost finished here, Jackie. Okay, so I have a sharp and a dull object. If you could close your eyes and tell me which one you feel.
Sharp. Dull. Dull.
Sorry.
Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp.
Okay, that was all normal, sharp, dull, sensory function. Now I have an item. If you could close your eyes again and identify this item I'm placing in your hand. This is testing the stereognosis. Hold out the palm of your hand and identify the object. Close it, feel it. What do you feel?
A key.
Yes, so appropriate stereognosis. Now I'll draw a letter in your hand with those eyes closed. This is testing graphithesia. What letter did I draw?
A.
Wonderful, graphithesia. And lastly, proprioception. With those eyes closed, I'm going to maneuver your toe. You tell me if I'm pointing it up or down.
Up, down, up, down.
Okay. Okay, now lastly, the reflexes. We've got the bicep. These are deep tendon reflexes. Both biceps are normal. Tricep, just dangle that arm. Okay. Dangle that arm, relax. Okay. And the supinator here on the wrist. Okay. All right. And the knee to the patellar reflex. Okay. And usually I'd have a hammer, but don't have this here in the clinic today. I'm sorry. And the ankle, I'll tap the Achilles. Normal, okay. Planter, I'm testing for Babinski. If you could close those eyes. Hope that you have an appropriate maneuver of the foot. Okay, the toes curled rather than fan out, which is appropriate Babinski. And now testing for clonus. Relax that knee and just let me move your foot. Okay, there was no additional movement back forth, so no clonus that I'm concerned about. I believe that completes one thing with the eyes. I wanted to test the visual field. If you could tell me when you see my fingers.
Yes.
Okay, great. Visual field, and now testing the 6 cardinal signs, testing cranial nerves 3, 4, and 6. So just follow my fingers. Wonderful. No signs of nystagmus. So I think that is everything. Any questions for me, Jackie?
No.
Okay, wonderful. Well, take care. It was great to meet you, and please come back or give us a call if you have any concerns, okay?
Thank you.
Pleasure to meet you.